Colon cancer is silently stalking 1 in 23 Americans. Don't let it catch you off guard. Today, we're diving deep into the critical symptoms of colon cancer that you should never ignore. We'll cover everything from early warning signs to advanced symptoms. Stay tuned till the end to find out how you can detect this silent killer early and possibly save your life or that of a loved one. Colon cancer is no longer a disease that only affects the older population. Recent statistics show a concerning rise in colon cancer cases, especially among younger individuals. According to the American Cancer Society, the rates of colon cancer have increased by 2% annually in younger adults since the mid-1990s. This is a stark contrast to the declining rates observed in older adults thanks to widespread screening. So, what's causing this uptick among the younger demographic? Researchers are still trying to pinpoint the exact reasons, but lifestyle factors like poor diet, lack of exercise, and increased stress levels are suspected to play a significant role. The rise in obesity rates, which is a known risk factor for colon cancer, also correlates with the increasing incidence of this disease among young people. This trend is not just alarming, it's a call to action. The healthcare community is now pushing for earlier screenings, even for those without a family history of the disease. Previously, colon cancer screenings were generally recommended for people over 50. However, due to the rising trend, the recommended age for initial screening has been lowered to 45. When it comes to colon cancer, misinformation abounds. One of the most prevalent myths is that colon cancer is solely a genetic disease. While it's true that having a family history of colon cancer can increase your risk, it accounts for only 5 to 10% of all cases. This means that 90 to 95% of colon cancer cases are not directly linked to genetics. So, if it's not just genetics, what else is at play? The answer lies in lifestyle choices. Diet, exercise, and even stress levels can significantly impact your risk of developing colon cancer. For example, a diet high in red and processed meats and low in fiber, fruits, and vegetables has been linked to a higher risk of colon cancer. Lack of physical activity and high stress levels can also contribute to the disease. Moreover, the misconception that colon cancer is an old person's disease has led to delayed diagnoses in younger individuals. This is particularly concerning given the rising rates of colon cancer in this age group. Early detection is crucial for effective treatment, and dismissing symptoms due to age can have fatal consequences. One of the most challenging aspects of colon cancer is its ability to go unnoticed in its early stages. The symptoms are often subtle and easily mistaken for less serious conditions, leading to delayed diagnosis and treatment. Let's delve into some of these early warning signs that should not be ignored. Hidden bleeding is one of the earliest symptoms of colon cancer. This type of bleeding is usually not visible to the naked eye and often goes undetected. It occurs when tumors start to form in the colon and disrupt the intestinal lining. The bleeding is usually so minimal that it doesn't change the appearance of the stool. However, over time, this chronic bleeding can lead to iron deficiency anemia, which may manifest as fatigue, weakness, and paleness. Therefore, if you experience these symptoms, especially if you are over 45, it's crucial to consult a healthcare provider for further evaluation. Changes in bowel habits are another early sign that should not be overlooked. This can include constipation, diarrhea, or alternating between the two. You may also notice changes in the consistency, shape, or color of your stool. For instance, stools may become narrower than usual. These changes can occur because a growing tumor may partially obstruct the colon, affecting the passage of stool. While these symptoms can also be indicative of other gastrointestinal issues, any persistent change in bowel habits warrants medical attention. Other early signs include abdominal discomfort, bloating, and frequent gas pains. These symptoms are often dismissed as indigestion or other minor gastrointestinal issues. However, they can be indicative of a growing tumor in the colon that is causing intermittent blockages or irritation. As colon cancer progresses, the symptoms become more pronounced and harder to ignore. While early symptoms may be subtle, advanced symptoms are usually more severe and disruptive to daily life. Recognizing these signs is crucial for timely intervention and effective treatment. Abdominal pain is one of the most common advanced symptoms of colon cancer. Unlike the mild discomfort or bloating that may occur in the early stages, this pain is often more intense and persistent. It can be caused by a tumor growing large enough to cause a blockage in the colon or even perforate the intestinal wall. The pain may be localized to one area or spread across the abdomen, and it often worsens after eating. If you experience persistent or severe abdominal pain, it's imperative to seek medical attention immediately. Weight loss is another red flag that should not be ignored. Unexplained weight loss of 10 pounds or more over a short period, especially when not trying to lose weight, can be a sign of an underlying issue. In the case of colon cancer, the weight loss may be due to the body's increased energy expenditure to fight off the disease or because a large tumor is obstructing the absorption of nutrients from food. Either way, sudden and unexplained weight loss should prompt an immediate visit to a healthcare provider for evaluation. Fatigue is also a common symptom in the advanced stages of colon cancer. While fatigue can be a symptom of various conditions, it becomes concerning when it is persistent and unexplained by lifestyle factors, like lack of sleep or high stress levels. In colon cancer, fatigue is often a result of anemia caused by chronic hidden bleeding from the tumor. The body struggles to produce enough red blood cells, leading to decreased oxygen levels in the blood and consequently fatigue. It's essential to understand that these symptoms are not exclusive to colon cancer. They can be indicative of other medical conditions as well. However, the presence of one or more of these symptoms, especially when accompanied by any of the early signs discussed earlier, should be taken seriously. Immediate medical evaluation is crucial for accurate diagnosis and timely treatment. Early detection of colon cancer significantly improves the chances of successful treatment. With advancements in medical technology, there are now multiple methods available for detecting this disease at various stages. Let's explore some of the most effective detection methods that are widely used today. Colonoscopy is often considered the gold standard for colon cancer detection. During this procedure, a long flexible tube with a camera at the end is inserted into the rectum to examine the entire colon. Any suspicious polyps or growths can be removed during the procedure for further examination. The test is usually recommended for individuals over 45 or those with a family history of colon cancer. Stool sample tests are another common method for early detection. The fecal occult blood test, or FOBT, and the fecal immunochemical test, or FIT test, are two types of stool tests that look for hidden blood in the stool, an early sign of colon cancer. These tests are non-invasive and can be done at home, making them a convenient option for many people. Another emerging method is the DNA stool test, also known as Cologuard. This test not only looks for hidden blood, but also identifies specific DNA markers associated with colon cancer. Lastly, the sigmoidoscopy is a procedure similar to colonoscopy, but examines only the lower part of the colon. It's less comprehensive, but can be useful for individuals who are at lower risk or cannot undergo a full colonoscopy for medical reasons. We've covered everything from the rising trend of colon cancer to its early and advanced symptoms, detection methods, and prevention strategies. Remember, early detection can save lives. Don't ignore the signs.